Good day everyone, I'm Andrea Jane D. Sabino, your student's nurse for today. And today I will be performing a return demonstration on how to give a complete bed bath and proper positioning of our patient. To start off, we must observe the standard protocols. First, we need to verify the doctor's order regarding for any restriction or limitations. Next, we should perform hand washing and observe other appropriate infection control procedure like cleaning and disinfecting the all surface and equipment needed to ensure a safety environment for us and to our patient as well. We also need to apply the principal body mechanics as a part of the standard protocols. This involves having a good posture, where your head upright and the shoulders back. Good morning, sir. I'm Andrea Jane D. Sabino, your student's nurse for today. For verification, I can take a look of your name, please. Please state your name, sir.
Prince Alida Sabino,
Okay. How about your birthday, sir?
March 22, 2012.
Okay, thank you. Thank you. So for today, Sir Prince, I'll be giving you a bed bath. This is important to keep your skin healthy. And it also removes and cleans your body for any dirt, debris, and respirations. Would you like to avoid at this point before we start the procedure, sir? After preparing the patient, gather all the materials needed. For this procedure, we will be needing basin with warm water between 43 degrees Celsius and 46 degrees Celsius. And also the soap. Linens including bath blanket, 2 bath towel, washcloth, and the clothes, and additional linens. If required, we also need clean gloves and the personal hygiene article like alcohol, lotion, and deodorant. Also table bathing equipment I have here at this side. To start the procedure, I have raised the bed in my comfortable working height. Lower the side rails and help the patient to assume a comfortable supine positions and remaining body alignment. Next, I will be put my gloves. Alright, this time, sir, I will be removing the bathtub sheet and I will be putting the blanket. That will be alright with you, sir? Okay po, Sir Prince.
Place a bath blanket over the patient. Have the patient to hold the top of the bath and remove the top sheet from the beneath the bath blanket without exposing the patients. Place soiled linen in the dirty linen bag.
Okay po sir, by this time, I will be removing your top sheet. If we are in the hospital settings, it's to lower the beds and raise the side wall. After removing the patient's clothes, next I have filled here a wash basin with warm water. And this time, let me check the temperature. And ask the patient if it's tolerable for him. Okay lang po ba sa inyo, sir?
Opo.
After checking the temperature, the next thing that I will do is to put the towel on the patient's chest and head.
Place a bath towel under the patient's head. Place a second bath towel over the patient's chest.
Sir, I'll be starting to wash your face.
Immerse a washcloth and wring it out thoroughly. Start forming a mitt with the washcloth. Using a clean area of the cloth for each eyes, bath from the inner to the canthus. Dry gently and thoroughly around the eyes. Wash, rinse, and dry the forehead, cheeks, nose, neck, and the ears. Wash the upper extremities and trunk. Place the bath towel lengthwise under the arm. Immerse a washcloth and wring it out thoroughly. Start forming a mitt with a washcloth.
This time
Aside
for
from bathing with water, apply minimal soap. Wash the hands and nail. Rinse and dry the arms and the hand. Wring out the washcloth thoroughly. Start forming a mitt again with the washcloth. Apply minimal amount of soap. Wash, rinse, and dry the axilla thoroughly. Move to the other side of the bed. Repeat the step with the patient other's arms, axilla, hand, and nails. Cover the patient's chest with a bath towel. Fold the bath blanket down over the umbilicus. Immerse the washcloth and wring it out thoroughly. Form a mitt with a washcloth. Make sure to apply enough soap. Bathe the chest using long firm strokes. Immerse the washcloth and wring it out thoroughly. Form a mitt with a washcloth. Make sure to apply minimal amount of soap. Bathe, rinse, and dry the abdomen. Wash the back. Help the patient assume a prone or a side-lying position as applicable. Place a clean towel lengthwise along the patient's side or back. Slide the bath blanket over the shoulder during bathing to keep the patient. Immerse the washcloth and wring it out thoroughly. Form a mitt with a washcloth. Make sure to apply enough soap. Wash, rinse, and dry the back using the long firm stroke.
This time po, sir, I'll be putting lotion on your back.
Apply body lotion to the skin and topical moisturizing agent if needed. Put the linen in a dirty linen bag. Put a clean gown or pajama top on the patient. By dressing the affected side first.
Okay Okay po sir, this time I will comb your hair po.
Assist the patient with grooming. Comb the patient hair.
Alright sir, for this now, I will be making your bed. Let me dispose my gloves.
This time, make sure to apply clean gloves. Start making the patient bed. Put the dirty linen in the linen bag or laundry bag.
For the last part of our bed bath, we need to check for the functioning and the position of the external devices, such as indwelling catheter, nasogastric tubes, intravenous, and braces. Assuming that we have already done for that part, the next thing we should do is to do the proper positioning of our patients. Before positioning of a patient in bed, we need to verify the healthcare provider's orders. The next thing that we should do is to provide the privacy for our rotations. After verifying the provider's orders, next we need to introduce ourselves and verify the patient identity using the two identifiers. Good morning, sir. I'm Angela Jane D. Sabino, your student's nurse for today. For verification po, can I take a look of your name tag po? Please state your full name, sir.
Prince Ali Peter.
Okay. How about your birthday, sir?
March 20, 2010.
Okay po, sir. In any of the following position, using the correct body alignment. Make sure to position the patient, protect pressures area, and begin with the patient lying supine. Remember to place the bed in a good working height. The patient in the supported Fowler's positions. Let us position our patients. For the first one, raise the bed to a working height and elevate the head of the bed to 45 degrees. Assuming that I have already elevated the head of the bed 45 degrees. The next thing that we should do is to rest the patient head against pillows. Comfortable na po, sir?
Use pillow to support the arms and hand of the patient if he or she does not have voluntary control, or use of the hands and arms. If needed, position a small pillow or rolled towel at the patient's lower back. Place a pillow or a roll under the patient's thighs. Support the patient's calves or ankles with a pillow or roll. Place pillows or rolls at the feet to keep the alignment. Maintain their suplections.
Next, position the patient in the supported supine positions.
Place pillows under the patient's pronated forearms, keeping the upper arms parallel to the patient's body. Place tronchante rolls, sandbags parallel to the lateral surface of the patient's thighs. Protect the patient's feet with a small tronchante roll. Place the fingers and thumbs of each patient's hands around a rolled cloth.
This time, let us position our patient in prone position using 2 nurses if available.
Lower the head of the bed of the flat position and remove any pillows. The patient arm on the side to be turned should be held alongside the body. Place a towel or pillow beneath the patient's abdomen.
At the count of 3, sir. 1, 2, 3.
Turn the patient's head to one side and support it with a small pillow. Support the patient's arm with a small pillow. To elevate the toes, gently wedge a pillow below his or her lower legs.
Next, position the patient in a 30-degree lateral or sideline positions.
Move the patient's upper trunk first, then move the lower trunk after. the patient knee that will not be the next to the mattress. Place of your hands on the patient hip and other on his shoulder. Roll the patient into his side forward view. Place a small tuck back pillow behind the patient back. Support the upper arm with a pillow at the level of the shoulders. Place the pillow under the patient's semiflex upper legs at the level of the hip. Place sandbags or roll parallel to the plantar surface of the dependent foot.
Lastly, let us position the patient into a SEMS or semi-prone positions.
The patient arm should be tracked alongside the body. Flex the knee of the legs that will not be next to the mattress and turn the patient into his side. Place a small pillow under the patient's head. Place a pillar arm out of the patient's side. Place a pillow under the patient's flex legs. Upper leg supporting the legs so that it is level with the hip. Place sandbag or small trunk enter rolls parallel to the plantar surface of the patient foot.
After doing a proper positioning on our patients, forget neatly arrange personal position of our patient, assuming that we are in the hospital. The next thing to do is to ensure the patient's safety, is to place the bed in a lock low positions with at least 2 but no more than 3 side rails. Assuming that we have done this part already, dispose of your supplies and equipments and leave the patient room. Remove and dispose the gloves. And perform proper hand hygiene. Document and record the patient response and expected or unexpected outcomes. Don't forget to include how much the patient participated. Thank you.